What were some of like the struggles you had initially when you started up doing ultrasound orthobiologics?
Well, initially, we didn't even have a machine or anything to process PRP. So now there are 15, 20 different companies who make these PRP products, and you can just take blood and put it in the centrifuge and spin it. The first time I did this, I used one of those old science centrifuges that we used to use back in middle school, and I had 6 individual little test tubes in there, and I put blood in the 6 test tubes, and then I spun it. I had to look up how to do it. I took out a little portion from each one, and then I injected the Buffy code that I have from multiple test tubes into the patient. And she did really well. It was a professional women's basketball player who was the first PRP injection I did, and her story's actually been documented online because she had this patella tendon issue for a number of years. And so initially it was really that a lot of people didn't know what this stuff was, and trying to figure out, how to do it, what were the proper rehab protocols, because really nothing existed back then. How were these patients going to do long term with this? So there were lots of challenges, and then just in terms of even educating patients. And so, nowadays, every day in my clinic, I have people coming in asking me about these treatments. But back in the day, like very few people outside professional athletes even knew what they were.